We begin tonight, of course, with the pay equity settlement. It began with a woman named Christine Bartlett and the Service and Food Workers Union. It was called the Equal Pay Case, and at one stage the appeal against it reached the Supreme Court, which sent it packing. It was dismissed as not sustainable, as likely to lead to rest home closures and therefore to significant job losses. But today, after 5 years, the government announced, and I quote, some of the health sector's lowest paid workers will share in a $2 billion pay equity settlement over 5 years. In total, 55,000 workers are covered, the overwhelming majority of them women. The figures are varied depending on qualifications and experience, but, and again I quote, for the 20,000 workers currently on the minimum wage of $15.75 per hour, it means on July 1st they will move to at least $19 per hour. This was announced by Health Minister Jonathan Coleman with Bill English about an hour ago. He spoke to us immediately afterwards.
Oh, look, it's going to be huge. I mean, 20,000 of these women are on the minimum wage, and they are going to get an instant pay rise, taking them up to $19 an hour. So they are going to be taking home in the hand $5,511 per year. So, you know, that is massive because, I mean, these people do very, very difficult work. It's been unrecognised for a long time. You know, I've worked with a lot of them as a doctor in my time, you know, in clinical practice. It is really tough work. And now they're getting the reward that they deserve, frankly. So, look, a really historic day. I mean, there's never been a pay rise like this in New Zealand.
For 55,000 workers, no, not to this extent. But look, and credit where credit's due. And in fact, in your media release, which I'm holding and I've just received, you thank ETU, the Public Service Association, the New Zealand Nurses Organisation and the CTU. I mean, you are a national cabinet minister thanking unions, and I hear from everyone involved it's been a constructive process. But there does seem to have been a kind of road to Damascus experience because this was appealed in the first instance all the way to the Supreme Court. Did the horse get led to the water by the courts and think, shivers, I'm here, I might as well drink?
Well, I mean, it was Terra Nova, appealing this because, you know, it had massive implications for them. But, I mean, the reality in any negotiation is two sides come to the table with a set of things they want to get out of it, and in the end, it's a bit of give and take, and that's where we've got to with this agreed position. Now, obviously, the unions would have wanted more. They would have wanted $2 billion of back pay, but we were able to deliver a settlement which actually the country can afford that also recognises, the hard work that these people do. So it's been a long process, 20 months, but the spirit in which it's been conducted has been excellent. It's been very constructive. And in the end, I think everyone, regardless of their political persuasion, you know, will be really happy to see these very deserving women being paid more because they deserve it.
So, one of the objections to this was that some rest homes, some are obviously doing very nicely, but some aren't. And they are not for profit, they're run by church groups or social agencies or whatever, that they simply can't afford it. What is the government's response to that?
Oh, no, well, the government is putting in $2 billion plus to pay for these wages. So were the arguments against the Christine Bartlett case always disingenuous? Because the government was always, at some level, going to have to stump up, right? Well, I mean, it was a negotiation, right? So, you know, there was always going to be a massive bill attached to it. And don't forget, I mean, the only reason we can pay this now is because of the excellent state we've got the books into over the last 8.5 years. So it's been the overall 50
Okay, so this is Bill English's tax cut redistributed to 55,000 aged care workers, right? Rest home workers.
Oh, look, I haven't said about anything that might or might not be in the budget package, but the reality is we've been keen to settle this for the best part of 2 years, as have the unions. There's been a pretty intense choreography around that. And this is a very historic day, you know, a massive $2 billion pay rise for 55,000 workers who are on average $16 to $18. So, I mean, it's just going to be massive for those people.
Yes. Can we talk about this as a pay equity case? Earlier in the interview, you talked about women, and they are overwhelmingly women, these workers.
That's
so
correct.
What does this mean as a precedent? Because we have the courts in the first instance saying, yes, this is a pay equity issue. We now have the government joining in to the tune of $2 billion. Where does this lead us?
Well, there's a couple of elements to it. So, look, this is all on the back of a court decision on the interpretation of the 1972 Equal Pay Act. As a result of that, there were two strands in the government's response. One was to negotiate to settle this deal, and then the other one was to establish some principles, and they were formulated by a joint working group involved the unions, business, government, to deal with future such claims. And so there'll be a bill passed soon to put that framework into legislation, and that will mean that other groups will be able to test the merits of their pay equity claim against that framework. So there will be a pathway there. But it doesn't suddenly mean, though, that there'll necessarily be, a massive outbreak of pay rises right across the country. I mean, there are conditions that have to be met for something to be defined as a pay equity issue, and they're all outlined in the joint principles. But one of the principal ones is that there's pretty much a single payer, and so there's not a wider market for people to go and exercise their skills. And so for care and support workers, the payer is essentially the government. So the argument was, their work was undervalued, and if they were men doing work of equivalent value, they would have been paid more, and there was no market for them to go and take their skills elsewhere to be paid a higher rate than pretty much not far off the minimum wage for the vast majority of them.
So 55,000 people are going to get a substantial pay rise.
They will. 55,000 people getting $2 billion over 5 years. If you're on the minimum wage, you are going to be taking home from 1st July an extra $5,500 in the hand, and I'm pretty happy about that.